Clostridium tetani. It is the organism that is a causative agent of the neuromuscular disease, that is the tetanus. Coming to the introduction, this disease is caused by the organism which is a gram-positive organism, that is Clostridium tetani, and it is an ancient disease. The disease tetanus is an ancient disease that was described by Hippocrates and Aratus. And the person who were able to transmit the disease in the experimental animals, that is the rabbit, was Carl and Ratton in 1884. And in 1884, the same year, Nicolet was a person who demonstrated that the disease is caused by a poison-like compound that is secreted by the organism, which is similar to strychnine. But the difference between strychnine and this toxin that is produced by the organism is that TETANOSPASMIN usually acts presynaptically, whereas the strychnine acts postsynaptically. So the discovery that the disease is not caused by the organism but by the toxin-like compound that is released by the organism was demonstrated by Nicolet. And it was Rosenbach in 1886 who was able to isolate the organism, that is a tetanus organism, the causative agent of the tetanus, that is the Clostridium tetani, in the pure culture, and was able to successfully transmit the disease in the experimental animal. And he has given the descriptive morphology of the organism as slender bacilli and having the terminal spores with rounded ends. And Kitasato was able to isolate the organism in pure culture and finally demonstrated that this organism is involved in the causation of the most fatal disease, that is the Clostridium tetani. This Clostridium tetani is can be seen as a harmless contaminant in the wounds. That is, this organism as a commensal can be seen on the human body and sometimes can be seen as a harmless contaminant in the wound, and hence we cannot directly go to the diagnostic thing that we can identify the organism in the specimen that is coming from the wounds, because this is a harmless contaminant. So there is a possibility that this organism can be involved in the disease and cannot be involved in the disease. And this organism is usually seen in the soil and is a contaminant in the intestine, sometimes can be seen in the plaster of Paris, bandages, and the other natural sources that are present in the environment. Coming to the morphology of the organism, this organism is gram-positive in nature. It is a slender bacilli measuring about 4 to 8 micrometer in length and 0.5 micrometer in diameter. It has a straight axis, parallel sides, rounded ends, and the most important characteristic feature of this is the presence of the spores. The organism can be seen singly or sometimes can be seen in the form of chains, and the spores that are usually present give the organism a drumstick-like appearance. They are present terminally and they are usually rounded in nature, and hence the presence of the spores give the organism a drumstick-like appearance, which is easy for us to identify in the gram staining. And the spores that are present depends upon the age the organism is in, that is whether it is a young actively growing culture or it is a old dormant culture. In the young actively growing culture, the spores are usually oval in nature, whereas the old dormant cells, they are usually spherical in nature. This organism is non-capsulated and motile by peritricate flagella, and hence can be seen as a swarming motion in the culture media. Coming to the cultural characteristics of this organism is an obligate anaerobe, that it is strictly anaerobic in nature, and exposure to a little amount of oxygen can inhibit the growth of this organism. The temperature at which the organism satisfactorily grows on the media is 37 degrees centigrade and the pH is around neutral, that is 7.4. This organism can be grown easily on an ordinary media, but enhancing the media with the blood and serum, we can easily get the pure culture of the organism. The surface colonies are difficult to isolate because this organism easily swarms when the culture is moist in nature, and the growth of the organism can be seen at the filamentous advancing stages. So at this particular area where there is an advancing filamentous stage, you can isolate the organism in a pure culture. And this organism is usually seen as a fine translucent film that is invisible on the surface of the media, and the growth can be seen only at the edges where the filamentous advancing stage is usually present. And apart from that, you can isolate the organism in a special technique which is called as a Fills technique, where the water of condensation in a agar slant is inoculated with a mixed culture with the other group of Clostridium species, and incubated and anaerobically for 2 to 3 days, you can see the pure growth of the organism, that is the pure culture, can be seen from the surface. And in deep agar shakes, they usually are 1 to 3 mm in nature, forming a fluffy ball-like appearance. They are spherical in nature with radial arrangements. And coming to the gelatin stab culture, in the gelatin stab culture, you can see the growth of the organism in a beautiful fur-like tree appearance. And apart from that, because this organism is anaerobic in nature, you can go for the Robertson's cooked meat broth media for the growth of the organism. Here the organism does not utilize the meat, but has the ability to produce acid and gas. So depending upon the acid and the gas production, you can identify the organism in the Robertson's cooked meat broth. And coming to the bread agar, which is again used to identify the strain of the organism. So initially when the organism is grown on this particular media, that is a blood agar, they form alpha hemolysis. That is a partial hemolysis can be seen, but on further incubation you can see the beta hemolysis. Now the beta hemolysis is because of the production of tetanolysin, a toxin that is produced by the organism. So this tetanolysin, which is a toxin, helps in identification of the organism that is producing the toxin. Next, coming to the biochemical reactions, which is helpful in identifying the organisms. This organism is completely a proteolytic one, but not saccharolytic. It does not act on any sugar. So when you are making the media, you have to be sure enough that is no glucose is added to the media. And this organism is indole positive. That is, you can see a ring at the the surface of the test tube. Next is MR and BP negative, and hydrogen sulfide and nitrates are not reduced. That is, hydrogen sulfide is not formed and nitrates are not reduced. Gelatin liquefaction is seen, but it is very slow in nature. And another important characteristic feature is this organism has the ability to produce a green fluorescence on a media that contains the neutral red. Coming to the resistance of this organism, now as we know that there are different strains of this organism that produces the spores. So depending on the spores production and the strain, the spores are highly resistant in nature. So some strains which produces the spores have to be exposed to for several hours at 100 degrees centigrade in order to get eliminated. So best way of eliminating this organism is for going with the autoclaving technique, that is at 121 degrees centigrade for 15 lbs and 15 minutes to completely eliminate the Clostridium sporulating organism. But when a mixed culture of Clostridium tetani having the spores and a non-sporulating organism is there, then you can apply the heat at 80 degrees centigrade for 10 minutes. That will be sufficient to eliminate this organism. These organisms are antiseptic resistance, and phenol at 5% and mercury chloride at 1% is not inhibitory to this organism. That is, they do not get easily killed at this particular percentages. But when exposed to hydrogen peroxide and iodine for several minutes, you can eliminate this organism. Coming to the classification of this organism have been classified into 10 types based upon the agglutination, and here the type 6 Clostridium tetani groups are usually non-flagellated. Others all are having a type specific flagellar antigen, and all of these strain produces the similar type of toxin which can be neutralized by any one type of antitoxins. Coming to the toxin, which is the most important part of this particular topic, this organism has ability to produce a potent toxin that is usually involved in the pathogenesis of the disease tetanus. So the organism has the ability to produce two important types of toxin. One is a hemolysin called as tetanolysin, and the other one is the neurotoxin, which is the one it is involved in the pathogenesis. So it is called as TETANOSPASMIN. Apart from that, third toxin has also been identified, which is called as non-spasmogenic, which acts upon the peripheral nervous tissue, but the role of this toxin involved in the pathogenesis is not evident. Now coming to the tetanolysin, the toxin which is heat labile, oxygen labile, similar to that of the toxin produced by Clostridium perfringens, Clostridium novi and Streptococcus pyogenes, and this toxin is not involved in the pathogenesis of the disease. Now the most important is that tetanospasmin, that is the toxin involved in the pathogenesis of the tetanus. So it is the one that is involved in mediating the disease, that is a tetanus. It is oxygen stable, but it is heat labile, which can be inactivated at 65 degrees centigrade. And usually this particular toxin is plasmid coded, that is the organism has a plasmid which has a gene that produces this particular toxin. So if the plasmid is removed from that particular organism, that is Clostridium tetani, it becomes toxin negative, that is not able to produce any type of toxin. So it is usually coded only by the plasmid which is present in the organism. And this toxin can be easily toxided. We can convert it into a toxide to use it as a vaccine, and can be easily toxided with the help of formaldehyde. That is, low concentration of formaldehyde can make the toxin a toxide one that can be used in vaccines, and it acts as a good antigen to induce the immune system of the host. When released, the oxygen is usually released as a single polypeptide chain, which usually gets cleaved to form a heterodimer having a heavy chain and a light chain. The heavy chain usually measures or has a molecular weight of about 93,000 Dalton, whereas the low molecular weight, that is a light chain, usually consists of 52,000 Daltons. It is a potent toxin, and the amount of toxin that is produced by this organism depends upon the type of strain, the condition in which the organism is usually growing. That is, the favorable condition is required for the production of the toxin. So in case of the human pathogenesis, the toxin is produced in a devitalized tissue which is having low oxidation reduction potential. Similarly, when you are growing this organism in the artificial media, you have to provide a favorable condition so that the toxin is produced. So the amount of toxin that is produced depends upon the type of the strain and the environmental factors, environmental condition in which the organism is growing. And the minimum lethal dose for infecting the human host is 130 nanograms. And there is a variation in the susceptibility from one individual to the other individual, from one animal to the other animals. This toxin is highly susceptible to guinea pigs, rats, rabbits, etc. Whereas this is highly resistant in the birds and the reptiles. That is, the birds and reptiles do not get infected with this particular infection, that is the tetanus. And in frogs, we can make the frog susceptible to this particular infection by increasing the body temperature. Coming to the pathogenicity of this disease, that is how the TETANOSPASMIN usually causes the disease tetanus. So here the organism has a very low invasive power. It is not the organism that causes the disease, that is a multiplication of the organism, but it is a toxin that is usually bringing about the pathogenesis of this particular disease. So this can be very well understood when we take an experimental animal and when we introduce the washed spores into the experimental animal, the germination and the toxin production is not seen until unless there is a favorable conditions. Now the favorable condition in the human host is that there should be a low oxidation reduction potential. It should have a devitalized tissue where the oxygen content is very less or it is nil in nature. And apart from that, the person who are immunocompromised, that is having low immunity, and the person with the concurrent infections. So these are the four factors that helps in production of the toxin in the human host. And this organism usually multiplies and produces the toxin which are absorbed by the motor nerve endings and are transported to the central nervous system intra-axonally. Now in the central nervous system, they are fixed by the gangliosides of the grey matter of the nervous tissue. So this is how the toxin that is produced locally can usually reach the central nervous system and are fixed by the gangliosides, which shows the pathogenic effect of this particular disease, that is the muscular rigidity or the muscular spasm. That is the characteristic feature of this particular disease. Now the function of this toxin is it blocks synaptic inhibition. So when this is absorbed by the central nervous system, it blocks the synaptic inhibition, and most probably at the inhibitory terminals that uses glycine as GABA as the neurotransmitters. And the abolition of the synaptic inhibition leads to the like uncontrolled spasms, which ultimately leads to muscle rigidity rigidity and the spasm because of the simultaneous contraction of the agonist and the antagonist in absence of the reciprocal inhibition. So you don't have an reciprocating inhibitions that is going on. There is a normal muscular things that are going on in that particular area. So it completely abolishes the muscular inhibition leading to the contraction, that is a muscle rigidity and the spasm, which is a characteristic feature of this particular disease. And the convergent patterns that are produced because of this disease is the most important muscle that is involved in that particular area. Now this disease usually can be the pathogenesis of this tetanospasmin or the toxigenicity of the tetanospasmin is usually determined the route by which it usually enters into the human being, or can be easily determined when we take up with the experimental animal. That is how it usually brings about the pathogenic effects. The route of entry of this particular toxin is also very important. Now when the route of entry is via the oral way, the toxin is usually digested by the digestive juices, and hence it inactivates the toxin. There is no disease that can be seen when the toxin is entering via the oral routes. But when it is given as intramuscularly, subcutaneously, it becomes lethal. But it becomes more potent when it is given as intraneural. That is highly lethal in nature when given in intraneural routes. This disease usually can be demonstrated in the experimental animal, and it shows three types of tetanus: local tetanus, ascending and a descending tetanus. So when the experimental animal is injected intramuscularly at the hind limb, it usually, the tonic spasms usually develop at that particular inoculated area, and it is because of the toxin that usually acts on the segment of the spinal cord containing the motor neuron of nerves that are usually carrying the message. So the local tetanus is usually caused initially, which later on the toxin enters into the spinal cord and it accents up, involving the other limb, hind limb, forelimb and the trunk. So this particular phenomena is called as the ascending tetanus. Now when the toxin is injected interneurally or interneural routes, you can see the spasticity of the head that usually first develops, then descend downwards to the neck, and again later on to the other parts. That is, it is descending downwards. So this is called as a descending tetanus, which is the normal characteristic feature or the natural infection that is caused by the organism. So based upon the segment of spinal cord that is usually involved, and based upon from where the route of entry is usually taking place, you can classify this tetanus into three types: local tetanus, ascending tetanus and a descending tetanus. So in a natural infection caused by the organism, it is usually, the clinical picture is usually similar to that of the descending tetanus. Now coming to the disease, that is a tetanus. The tetanus is a disease of a tonic muscular spasm where there is uncontrolled contraction of the muscular cells or the muscular tissues. You can say a single muscular tissue or a group of muscular cells. So here there is uncontrolled contraction that can be local, and sometimes it can become generalized, involving the somatic muscular systems. And this disease usually follows any injury. Wherever there is an injury, you can see the organism getting established on that particular infection and releasing the toxin to show the infection. So it is only after the injury that you can see the disease that usually develops. And the puncture wounds provides a favorable place for the growth of this organism and the release of the toxin. And hence puncture wound provides a satisfactory platform, you can say, for the development of this particular disease. Sometimes this disease can also be followed by local suppuration such as otitis media, and it is the major complication of this disease is a septic abortion. And the unhygienic practices can also be one of the reasons for the development of this disease. That is, initially people used to use there's a cow dung on the umbilical cord, and ear boring is another factor, apart from that circumcisions. So these are the reasons when unhygienic practices usually takes place leads to tetanus. Sometimes unsterile injections can also lead to tetanus. The incubation period of this disease usually varies from 2 days to weeks, and again depending upon the condition of the patient, depending upon the strain that is involved, depending upon the satisfactory environmental factor that helps in the growth of the organism. So the optimum period for the incubation period usually is 6 to 12 days, and the incubation period is of a prognostic significance. And apart from that, the important significance of this disease is the starting of the symptom, that is a trismus, which is a lockjaw, which is characterized by lockjaw, and the spasm that is usually involving the generalized infections. The disease shows a higher mortality rate of about 80 to 100% in the individual who are not treated, and even in the individual who is given treatment, the mortality rate can be from 15 to 50%. And in case of the diseases such as tetanus neonatum and uterine tetanus, the mortality rate is about 70 to 100%, and the disease autogenic tetanus usually shows less mortality rate. And this disease usually seen in the developing countries where the climate is very warm, and in rural areas where the soil is very fertile, and there is a close association between the animals and the humans, and also where there is unhygienic practices and poor medical facilities. In India, it is rural India, you can see it is the disease that is usually the causative agent of the disease of the neonates, and causes the death and shows a high mortality rate of the neonates. But due to the development of the immunization program, the disease has drastically come down. Coming to the lab diagnosis, which is very important for us to identify the organism, because there are many different diseases that are related to wound infection. So we have to have a very good and a sound knowledge about which organism is the causative agent, so that we can go for the successful treatment. So the most important way by which we can identify the organism is via 3 ways. One is you can go for microscopic technique, next is the isolation of the organism in a pure culture, and next you can go for the animal inoculation to finally identify the toxin that is usually causing the infection. So coming to the microscopic technique, as we know, we directly go for the samples of gram staining, and we know the morphology of this organism, that it is appears as a drumstick like appearance. So identifying the organism is not a presumptive test in the lab diagnosis, because as already discussed, this is a contaminant as a harmless contaminant on the wounds, so we cannot finally give a confirmatory report after identify the organism in the microscopic technique. So further confirmatory tests are usually done with the culture. So for the culture, we need to have a specimen. The specimen over here is an excised bisque from the necrotic areas of the wounds, and here they are initially inoculated on a blood agar plate. So one thing that you have to remember over here is the blood agar plate is divided into 2 parts. So on one part of the plate, the organism is inoculated. It is because the organism have the ability to swarm and move to the other part. So only one part of the blood agar plate has to be inoculated so that the swarming takes place at the other end. And as we all know, the growth is not easily identified in the surface colonies. And in order to isolate the organism in pure culture, you have to go for the filamentous advancing stage, that is the swarming edges, where you can see the organism growing and isolated in pure culture. Next way is growth of the organism in anaerobic media, that is a Robertson's cooked meat broth. 3 tubes are used over here. Now let me tell you the reason for using 3 tubes. Now the 3 tubes have been inoculated, and the first tube is exposed to 80 degrees centigrade for 15 minutes, second is for 5 minutes, and the third one is unheated. The reason behind the temperature variation over here is to identify and isolate the organism that is usually sporulating in nature. Different strain produces different types of spores that are usually heat resistant. So in order to identify that strain having the spores, you have to go for this 3 tubes treating with different temperatures or temperature variations, or heating the tubes at different temperature. So once we get the culture from this, you can go for the subculturing on a blood agar plate. Again, the same thing, the one end of the blood agar plate is inoculated to identify the organism. And in order to make the media a more selective one, you can inoculate, or you can prepare the media by using polymyxin B. The polymyxin B is an antibiotic that does not have effect on Clostridium tetani, but inhibits the other group of organisms. So it makes the media a selective one to isolate and identify only the pure culture of Clostridium tetani. Now coming to the identification of the organism that is usually producing the toxin. Now we know that the organism has a little invasive power, but it is the toxin that is mostly active in nature and involved in the pathogenesis of the disease. So you can identify the organism that is producing the toxin by inoculating it into again a blood agar media, which is divided into two portions. Now here one thing you have to remember is the one portion is usually inoculated with an antitoxin that will inhibit the growth of the organism that produces the toxin. So the blood agar plate is prepared with a 4% agar to prevent the swarming. There is no diffusion of the organism, and then it is tab inoculated and it is usually incubated in anaerobic condition for 2 days. Growth of the organism is seen only on one portion where there is no antitoxin that is inoculated. That indicates that the organism is toxinogenic in nature or is able to produce the toxin. Now from this particular culture you can take 0.2 ml of the pure culture and go for the animal inoculation to see the effects of the toxin on the animal. So it is usually inoculated or injected onto the tail of the mice. You can see the characteristic features of this particular disease, that is there is a stiffness in the tail first, and then you can see the rigidity of the spasms or the stiffness, rigidity in the legs, first the legs on which it is inoculated, then on the opposite leg involving the trunk, forelimbs, etc. Now you have to have two types of mice over here. One is a test mice and the other one is a control mice. So in the control mice we already give an antitoxin to prevent the death of this particular control mice. And here in the case of the test mice which is not inoculated with the antitoxin, the test strain usually dies within 2 days. So this indicates the identification of the toxinogenic strains of Clostridium tetani. So first we go for the lab diagnosis where the microscopic testing is done, then we go for the cultural identification of the organism, and next is identification of the organism that is producing the tetanus toxin, that is TETANOSPASMIN. Now this coming to the next part, that is a prophylaxis, how to control this disease. Now because the spores are usually ubiquitous in nature, we cannot prevent the contamination of the wound. The best thing is to control ourselves from this disease is the antitoxic immunity or the active immunization. And next is, as we all know, that strain of the organism and the immune system of the host. The three methods can be adopted to go for the control of this disease. First is the surgical attention should be given. Any excised, any foreign bodies that is present in the wound, any blood clots that is present in the wound have to be completely removed to prevent the spread of the infection. Now coming to the antibiotics, as we know that the organism usually multiplies and produces the toxin. So you cannot prevent the toxin from the antibiotics, but you can inhibit the growth of the organism by treating with the antibiotics. So long term use of penicillin can prevent the growth of this organism and production of the toxin. But the toxin that is already formed, we have to neutralize with the antitoxin. Next is immunization, that is use of antitoxins. Immunization is the perfect method where we can control this particular disease, that is the tetanus, and prevent the disease that is caused by the tetanus. So the passive immunization is usually given to the patients who are usually immunodeficient in nature. That is, the immunity is very low and the person who is not able to produce his own antibodies or antitoxin towards this particular toxin. So tetanus antitoxins have been prepared commercially, and mostly the ATS toxin that was produced from the hyperactive horse serum was usually used. But because there are certain drawbacks associated with the ATS, that is, there is a possibility that because this is a heterologous serum, there can be an immune elimination from the host. Apart from that, because it is a heterologous serum, it can lead to hypersensitivity reaction. So these are the true drawbacks of the use of ATS, that is the antitoxin produced by the horse serum. Next was the anti-tetanus serum that was produced by bovine and cattle, bovine and ovine ATS, but this also showed the similar types of symptoms. So now we have the anti-tetanus from the humans, that is called as a human anti-tetanus immunoglobulin, that is TIG, that is most effective at least concentration. But the problem is the availability of this human immunoglobulin anti-tetanus toxin, because the human volunteers are less to come up to give up this particular procedure. But in emergency cases, you can go for the human anti-tetanus immunoglobulin. Apart from that, you can go with the active immunization, which is usually given in the form of a plain toxide or an adsorbed toxide. Here, the mostly preferred one is the adsorbed toxide on aluminum sulfate. Which usually gives a more good result when compared to the plain toxides. And this particular active immunization with the plain or adsorbed toxide can be given in a single injection, subcutaneous injection, that is only a single tetanus immunization can be done, or you can go with the triple vaccine, that is DPT, diphtheria, pertussis and tetanus toxin. So triple vaccine can also prevent from this particular disease, where pertussis usually acts as an adjuvant. Adjuvant is nothing but a compound that enhances the immunogenicity of that particular vaccine. So here pertussis vaccine usually acts as an adjuvant, and hence the DPT can prevent from 3 diseases: diphtheria, and we have pertussis and the tetanus. So this immunization is usually given in 3 doses, which is given, the first 3 doses are usually given at an interval of 4 to 6 weeks, and the third one is given 6 months later, followed by a booster dose after 10 years. Now, when the person is infected, in that case, you can go for the booster dose instead of giving the active immunization or TIG and ATS. You can go directly with the booster dose. Now, apart from that, you can go for combined immunization, where the TIG is given along with the toxide. So, if the TIG is injected at one hand, the toxide should be given at the collateral side. So, it is given in the monthly intervals, and the toxide that is mostly preferred over here is an adsorbed toxide. So, when we are going for passive immunization, we should see to it that we are giving a combined immunization too. Now, coming to the treatment aspect of this particular disease, the disease is usually not transmitted from person to person, but the patient have to be treated in a special ward to prevent the conversion, because when the person who is suffering from this disease, when is exposed to light or the sound, there is a striking increase in the conversion pattern. So, in order to decrease that, you have to isolate the patient. So, people have one thing in that mind, that this disease is highly transmissible and usually gets transmitted from contact. So, it is not a particular thing that the disease usually transferred via person to person, and the organism cannot get like transmitted from person to person. So, in order to just prevent the increasing conversion patterns, you have to isolate the person and treat them in an isolation ward. And you can go for the artificial respiration with the tracheostomy, or you can go for positive pressure respiration in order to make the person relaxed and with abundant amount of oxygen, because less amount of oxygen can result in the production of the toxin and spread of the infection. So, exposure to more amount of oxygen prevents the spread of the infection. And then you have to go for the assisted feeding, and during the treatment procedure, along with the antibiotics, you should involve human TIG with about 1000 international unit, which is given in IV dose slowly. If required, you can again give for a 5000 international unit dose. And the antibiotics that are mostly given are penicillin and metronidazole. You can also go for the antiseptics or the topical application to inhibit the growth of the organisms. And the anti-tetanus, in case of person who are not allergic towards this anti-tetanus with the horse serum, then you can go for anti-tetanus 4, which is usually given as a massive dose and has an effective treatment effect. And full dose of active immunization to be given to the patient who has already recovered from this disease, because there is a chance of secondary attack of this particular disease. So this is about Clostridium tetani.